Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. Super excited to have you here because we are having some really fabulous conversations with some incredible leaders that are painstakingly reshaping the future of healthcare. If you haven't been here before, let me just sort of take a quick step back and tell you a little bit more about what we're trying to do here. So we're passionate about a few different areas. We're super passionate about access, about innovation and transformation and leadership. And our focus is on bringing these types of stories to light and giving folks the opportunity to share their learnings and share their little wins with our community and ultimately with the world. So however you're consuming this, if you're watching this, if you're listening to this, please hit the subscribe button now so that any new interviews come directly to you. Okay. So I've been doing a lot of thinking lately. And you know what's interesting to me? Um, we've been talking about digital transformation in healthcare for a long time. And I mean a long time.
Mm-hmm.
And yet, when you go into a doctor's office, there's, in many instances, there's actually still a clipboard there waiting for you.
Sure. Yeah.
I mean, it's 2026. How does this happen? And here's what I think.
Yeah.
I believe that this is something that we've been saying for a while now. But there's a big difference between things that are happening inside of a health system, folks that are buying technology, and what a system does to configure that technology for it to be ready to be used, to deployed at scale. So those are two totally different things. And today's guest, Jen Hopper, who is a digital transformation leader at Beacon Health System, one of the largest locally owned nonprofit health systems in the Midwest. They are serving thousands of patients every single day across Indiana and Michigan. And I think what I find compelling about what Jen thinks and how she approaches this type of work is she doesn't call them users or encounters, and she calls them stakeholders. I find that really fascinating. I think this is a different mindset, and I want to really kind of explore that today. So outside of Beacon, she's been widely recognized, and you obviously only get that when you show up and you're consistent and you're diligent about the work that you're doing every single day. So I'm really excited to jump into this one. Jen, awesome to see you. Welcome to the show.
Thanks, Michael. I'm delighted to be here. I love your program.
Thank you, thank you, thank you. All right. So before we dig into Beacon and all the work that
Yeah.
you and your team are doing, I always want to sort of, I don't know, it'd be nice to kind of know the person in terms of how you got here. So maybe take me back. Was there like a specific moment, an experience where you looked at see how patients were being treated and thought, this is not great, and somebody needs to improve it. Like, what was there a moment like that for you that kind of brought you to this type of work?
I started my early career in customer service. So I had that really drilled into my head. I worked retail for a long time,
Mhm.
and contracts, and I was like dealing with patients who were clients that were part of an acquisition
Yeah,
that
yeah.
had to re-sign contracts. And so I had this like these lots of conversations with really frustrated people. So my early career was really framed by how we talk about common goals and make sure that we're
Yeah.
meeting common goals. And as I got older, one of the first jobs I had out of college was in marketing, and I came in as a marketing strategist at actually one of our other local health systems and got a good education from some wonderful professionals there about
Hmm.
how marketing is different in healthcare versus
Yeah.
the other worlds I'd been a part of. And at the same time, my dad had a major health event, and
Okay.
not at our health system, but I was able to join him as just support at
Okay.
that healthcare system and to see how they operated. And that was a real, like, seeing it with that lens on was very
Yeah.
different.
Yeah.
Yeah.
Interesting.
So He had a wonderful experience at that location, and he had cancer, so he had several other hospital visits over that time, and I was able to see how those experiences differed from different organizations and
Yeah.
the pressures that, as caregivers, we felt like we were under in some cases to keep an eye on him, to make sure that he was being fed, to make sure that
Right.
that his physician was informed about things that we were informed about things. So
Mm,
that all of that happened at a really formative time for me.
that's super interesting. I mentioned it earlier, but you write about patients as stakeholders. I'm
Mm.
like, where did that come from? Because that's like you don't usually hear that framing in the industry. Was there like a person behind that idea? I'm just very
That's
curious
my
about that.
MBA talking. Yeah, I mean everybody's a stakeholder, right? When
Okay.
any initiative that we do, we it's my MBA talking, it's the process improvement training I've had. You have to look at everybody that's involved in a business decision or a workflow that you're changing.
Right.
Uh, and I think in healthcare, to your earlier point, our our history in healthcare is looking out for ourselves because patients did not have a choice, right? You went to
Right.
the doctor. You went to the doctor that your insurance company told you to go to because you didn't have a choice, and you just dealt with it. The climate that we're in now, patients have a choice. They absolutely have competing health systems. They have competing retail providers
Right.
around us. And some of those retail providers have really great customer service experiences. So we're going from a world where we may deliver excellent care, but we're
Right.
not giving you the patient tools that you get from a Amazon or a CVS or
Hmm.
a Walgreens or some of these other retail folks that have the customer experience solid. Um, we have to figure out how to navigate that now and deal with the competition from unexpected directions.
Also to that point, the consumer is getting way more educated. We're
Oh
talking
yeah,
about folks that aren't just tech
great
savvy
point.
now. They're
Yeah.
they're tech dependent. They grew up with a smartphone.
Hmm.
Information's easily accessible. It takes literally less than 10 seconds for someone
Yeah.
to Google a doctor or a clinic to make
Hmm.
a very quick assumption as to whether or not if it's going to be good for them to actually go there or not. And if it's not,
Hmm.
like we're just in an instantaneous society where people want information at the snap of a finger and then they make choices.
Hmm.
And those choices obviously lead to either people walking into your clinic or not walking into your clinic, which are huge.
For sure.
And so, Beacon is pretty vast. I mean, this is like nearly 150 care sites. You guys are serving thousands of patients
Yeah.
every single day. Um, it, I'm just thinking, like, if you're trying to change how an organization of your size actually delivers on that digital experience, that digital promise, what does that look like on the ground? Like what is a
Yeah.
Tuesday morning or whatever? What does a Wednesday morning feel like when you're in the middle of like a rollout of a project or some sort?
There's so many things that go into it that I think folks from outside might not see. There's a lot of standardization that we've especially had to tackle. I was trying to think back. So, Beacon Health System, my husband's been working for Beacon for like 15 years. And when he started, he worked for one of our community hospitals before it was
Right.
acquired by the other hospital. And when that hospital acquired it, it became Beacon. And at that time, we had non-standardization between those two hospitals. Well, since then, we've acquired three other hospitals and a health system and two physician networks and so on. So all of these docs had processes of their own. They had new patient forms, they had digital
Yeah.
intake or registration forms and so on. Any form you can think of, and there's a million of them, right?
Yeah.
That we've had to process. They were all unique. So the first thing we have to do is standardize that.
Jeez.
Because if we're going to digitize anything, make anything a digital experience, it has to be standard. And that continues to be a challenge. We haven't stopped
Do you feel like
standardizing.
clinicians don't like the word standardization? I mean, I
Well,
don't think I've
sure.
ever I don't think I've ever met a clinician that's like, yes, standardize this,
No,
please. Like they don't like that
no,
word. It's a
because
dangerous word. It's a dirty word.
No, it's a dirty word because they don't want anything to come between them and the care that they provide. And they believe that they
Yeah.
need their process to deliver that care. So, obviously, we have physician dyads, we have groups that meet that work with physicians to try to, everybody agrees on the
Hmm.
thing that they need. But it is a process. Yeah.
When you have disruptive
So,
innovators, sorry, finish your thought. I think you were going to say something else.
I was going to go through the rest of the process that it takes
Please,
to
please.
digitize, but okay.
Go. Yeah, I want to know more. Yes.
Sure, yeah. So once we've got our information standardized that we need, then we have to look at what happens on the back end to it. And so we've got to standardize the workflows. And again, from office to office, you might have front desk staff that are doing everything, or there might be a back office process that does part of it, and we have to standardize all of that. We sit down and talk about the patient experience. So one of the things that we have done is the Google design sessions. So think about what's the ideal way for the process to work?
Mhm.
How do we get there? How might we, right? That's the question that Google asks is how might we? How might
That's
we
such a
deliver great care?
powerful question. How might we? Because that
Yeah,
encapsulates everyone working all together. There's probably a lot of
yeah.
NLP baked into that one.
Absolutely. And it's great when we get into these sessions if you can really step out of all the reasons that you can't, right? That's the hard part is stepping away
Hmm.
from we can't do that because or this is the way we've always done it. Step back and we talk about how might we? How might and think big picture. How might we get the patient's registration before they get to the office? What's the best way to do that? Is that through the mail? Is that through a digital registration? How might we
Hmm.
deliver it in more than one way? Right. So
Right.
can we collect it on the phone for patients that maybe don't have access to either of those methods?
Mm.
So those are really powerful sessions, and it often, because they are multidisciplinary sessions,
Right.
often gets people that are working outside of those groups get their wheels really turning because it helps them to see how the work that everybody else does affects their work and vice versa.
Are those sessions, are they timed? Are they facilitated? Like, how do you not go
They're
down a rabbit hole?
facilitated.
Okay.
Yeah, that they do tend to be timed. We often have to break them into multiple sessions to, everybody's got a busy calendar, but if you can get a couple of hours in straight on that work, the ideas really get flowing.
Mm. So let's just say you have a host of ideas, and I would imagine that you don't have a shortage of good ideas. Like a lot of people have good ideas, but
Sure. Yeah.
what makes a good idea get on the priority list to actually get executed? Like what has to happen?
That's a great question, Michael. There's there's a process of what are good ideas that can happen now and what are good ideas that
Yeah.
we are going to work toward, right? So
Yeah.
that I think is honestly the bigger question is how do you can get to some great ideas that you can execute on now and some of that even is a bit of a process, but not losing sight of the great ideas that you had at the beginning that maybe we couldn't execute on, maybe the vendor technology isn't there or we don't have the staff to support that complete change in workflow.
Hmm.
That's the hard part, I think, because we come up with some great
Mm.
ideas that just kind of get lost because we get stuck in the day to day. And then in 3 years, we go to redo these design sessions, and somebody goes,
Yeah.
"Hey, I think we had some notes." Yeah, I got to dig those up.
Well, is it more along the lines of, hey, really good solution, low friction to deploy it, high
Yes,
return. And if
very
it's
much.
low friction, high
Yeah.
return, like let's rank it.
Yes,
Is it
very
is it
much
it's one of
that.
the it's kind of one of
Yeah,
those.
we
Okay.
definitely put that on a scale.
Okay. Okay. And then you mentioned something around vendors. And
Mhm.
I really don't like the V word because it seems
Okay.
just super transactional and non-committal and non-relationship oriented. But I guess what's like the biggest mistake that vendors make when they walk into Beacon and they're trying to tell you a story and pitch you on transformation? What do they maybe almost always get wrong?
Mhm. I think when they're doing these conversations, they spend a lot of time because they're writing the checks, right? They're talking to leadership
Right.
And that's great because they've got to sell them on the vision. But getting some of the folks that are a little bit closer to the ground involved helps you to ask the right questions and understand how far are we from really getting to this solution and how do we get buy-in? Because if you can't get the leaders involved that are a little bit further down and get them engaged and get them excited and get them believing that you can execute on it, it's going to be a hard row.
Mm. Hmm. So let's just say they get through all the gauntlet.
Hmm.
They have executive buy-in. They have buy-in amongst um, sort of mid-level, frontline. They get all that. I would love to hear a story about maybe a specific implementation that really humbled you. You know, maybe something that you're super confident about. Um, and obviously you're always kind of all in, but like what happened
Sure.
from that? And what did you kind of learn from it?
Gosh, I could tell you, oh gosh, how to pick a story.
I mean,
They all,
just pick
yeah,
one. Pick one where you feel good about sharing it.
sure. I will say the first time I implemented digital registration, I had come from an HRIS vendor. It was a startup, it was a small organization, and I was used
Hmm.
to meetings that had 6 or 8 people in them.
Yeah.
And coming into healthcare, these meetings, and these were operational meetings week after week after week, had easily had 30 to 50 people in them. Everybody had to be a part of designing this experience.
Wow.
I'm not going to say that everybody on those calls was engaged, but
Right.
that was really overwhelming for me at the beginning to be like, golly, we got to get all of these folks bought in and engaged and organized, and the scope of really what we had undertaken kind of hit me. Since then, we have implemented digital registration a second time, and I, coming from the vendor side, now have a lot of expectations of, I'll stop using that word, partner side,
Yeah, yeah. No, you
business
can say
partner
vendors. It's
side.
your episode. You can
Okay.
do whatever you want.
Coming from that side and having seen the back end, and I know what I expected of my team when I managed an integrations team, the quality of work that I expected, what I would and would not deliver to a client. I keep my standards pretty high. And some of the vendors, and I will say more recently than when I first started at this health system 5 years ago, really surprised me in what they're willing to let walk out the door.
Really?
Mhm.
Just not high enough standards. Do you
Mm-mm.
let them know
And
that? Did you let them know
oh,
that?
I do, but I'll tell you, Michael, I think it's AI. And you know me, I write about AI. I love some AI. I am excited about the future
Yeah.
that AI can bring to healthcare because there's so much opportunity. But I also think it's really easy to push stuff out and have false confidence in it because it
Hmm.
came from AI. And I think that happens a lot.
You can't outsource your thinking. You just
No.
can't.
And your
It can help. It
QA.
can, yeah, I was gonna say you gotta have a human in the loop in many
Yes.
instances. You know, we were just kind of talking about this off camera. And, at what
Hmm.
point is the trade-off worth it
Yeah.
to remove the human to fully go AI? And
Yeah.
I have this theory, and it's just kind of call it the AI treadmill. And
Mm-hmm.
people are super excited to get on the treadmill. And they're like,
Mm-hmm.
look, we're moving. We're doing all these things. But what they don't realize is that they're actually on a treadmill. They're not actually advancing and going ahead.
Yes.
They're just on a treadmill. What do you say to leaders that think they're moving, but they're on a treadmill? How do you let them know that they're actually
Yeah.
on a treadmill? They're not actually moving ahead.
I think it's hard. You have to prove it. And executive leadership is that way, right? They're going off the data. So you have to prove that, yeah, we saved time here, but we're not saving it here. You got to break it down to numbers. That's the language that they understand. Break it down to numbers and dollars.
What is this? What is sort of the metric let's just say that intake and registration project
Mm,
that didn't go as planned the first time. It sounded like there were too many chefs in the kitchen.
yeah.
There's probably a mismanagement of expectations,
Hmm.
and you try to please everyone, which in the end means you please no one.
Hmm.
Um,
Nailed
you
it.
deploy for the second time,
Yeah.
and you nail it. You tighten things up. Talk about what you tightened up, and then what were the metrics that you and the team landed on that everyone was like, yeah, we feel good about these numbers. And if we hit these numbers, like we're doing great. What was that like?
Sure. Yeah. So there's a couple of things that we learned. The first time we implemented digital registration was the first time. We didn't know anything about it. We didn't really know what the goal was, and we were expecting that vendor to be our guide, right? Help
Yeah.
us understand um, that maybe a shorter interview or a shorter registration form is better. They let us put together the Bible of registration forms, and then when patients didn't complete it,
Ah,
it took a few
so
weeks for them to come
You
back and go,
Frankensteined it. You
say,
Frankensteined
yeah,
it, and
very
then
much, because everybody said we have to have this question. We have to ask this every time. And patients got frustrated because nobody wants to answer where they work every time they come to the doctor, because you change jobs more than once a year? Probably not.
yeah,
So there are just questions like that they patients rightfully get frustrated with being asked every time. So we pared that down, and we got it down to a list of questions that really um, felt like the right number, and our numbers showed it, because we saw really good engagement from patients. They Once they start the form, they complete the form. So we had that base to start with the new vendor, and we're still learning. The new vendor works a little bit differently. So
mm,
the way that we get analytics from this new platform is different from the last one. So we're trying to, solidify that. What we're hoping to be able to tell, the story that we'd like to be able to tell with some time, because what we did is consolidate several vendors into one, is to look at the the whole patient journey. So patients that schedule online
right,
and to complete registration tend to show up to their appointment early, tend to self-arrive. We want to be able to prove these theories out because we believe them to be
interesting.
true, but nobody
Mhm.
knows without the data. And then how do we serve these digital patient segments better, and cater to patients that maybe need a little bit more
Mm,
holding?
mm. That's interesting because I think along the same lines, um, you've talked about um, patient acquisition. Like there is a difference between patient
Mhm.
acquisition and operational readiness. And we talked a little bit
Mhm.
about this off camera, but I think there are a lot of health systems that might be guilty of this, was they build the front door and the house isn't necessarily ready yet.
Yeah.
How did you learn that lesson? And how do you protect, against that happening at Beacon?
Yeah, that's a great question. We learn every time. Every time we put together a new product and roll it out to patients, we're asking for patient feedback, and that's critical. I think the earlier implementation of digital registration, patients had one opportunity to give feedback, and that was
Mm,
after their appointment. Well, by then they have already done online scheduling or digital registration, self-arrival, had their appointment. And so the thing that's clearest in their mind is their appointment. And of course, they had a great experience, right? So that's what they're going to tell us.
yeah,
But
yeah.
we didn't hear about all of the earlier parts of that patient journey. Now we're asking them throughout the way. And I think
Mm,
that's been the most critical thing, because that recency has been helpful to let us know that maybe part of that online scheduling platform wasn't working right. We had a bug that didn't get caught, and it only
right.
happens to this specific segment of patients. So we get the opportunity to hear that. That's probably been the biggest lesson. We were worried that patients might get tired of providing feedback, but I think what we've learned is everybody likes to be asked their opinion. So we're getting it.
Yeah, listen, you get feedback, you get it in real
Yeah.
time, and then you have the opportunity to
Yeah,
course correct. If you choose not to course
exactly.
correct, do you feel like the consequences are much greater now knowing what you know in terms of getting that feedback?
Yeah, absolutely. Yeah, because they're going to tell us about it in the feedback, and that feedback goes multiple levels, right? there's
Yeah.
all kinds of levels of leadership that are seeing it. They're going to tell the office about it. I told you guys the last time I came in that this wasn't working. So the
Mm,
staff will tell us about it. And they've got online forums, right? And I just saw last week a post in a local forum, somebody asking for where they should have their baby. And there were lots of opinions about it in that forum. So we know patients they're gonna talk
interesting.
about it if it's a good or a bad experience. And unfortunately, they're going to scream a lot louder when it's bad.
Yeah. Is there anything that's, I'll just say figurative, like a conversation that nobody's having inside of health systems right now that they absolutely ought to be having? Like, what is it? There's certain things that just aren't talked about that need to be talked about. What are those things?
Oh, all those things. I have so many things. I have, okay, so I think there's a healthy balance between automation and people. So I am a very digitally savvy consumer. I
Yeah.
am a Xennial, so I'm on the border of Gen X and millennials. And I sometimes don't want to talk to a human, and that's okay, right? I like
Yeah.
having the option to fill out the form and not speak to a person. But I also recognize that there are patients that need that.
Yeah.
We get lots of feedback from patients that that's the one time they're going to talk to somebody this week. Maybe they take a bus or they have a caregiver that brings them to their appointment. They look forward to seeing um, Sally at the front desk every week
Yeah.
because she smiles at her and she asks her about her kids. And she really looks forward to that personal interaction. Maybe her daughter fills out her digital registration for her because she doesn't know how, and that's okay.
Yeah.
But I think there's going to be patients that need one or the other, and we're in a time where we have to be able to cater to everybody. We just do. We have to be able
Yeah.
to provide um, all the experiences because people's digital savvy is such a broad range. So
Yeah.
that's
I
my
mean, you
first
might
thing.
you
Healthcare
might
is
get
human.
1,000%. You might get someone, like you said, who doesn't want to talk to a human being, and maybe it's because they grew up with this weapon of mass distraction here, and that's what they want to
Right?
do. And then you have someone else, who lives in an assisted living facility, might not necessarily get
Yeah.
the type of socialization that they want. But you know
Mhm.
what? Maybe that person at the front desk, maybe he or she makes them feel seen.
That's
And if
it.
there's one thing that you can
Yeah.
give someone is like you can give them dignity. Maybe the smile or the comment or the compliment,
Yeah.
they do go long. I want to make
Yeah.
a note
Well
of
said.
something because
Hmm.
because um just in prepping for this conversation, I've just noticed something. I've read some of your writing on LinkedIn, and I just want to ask you, like, I really enjoy how you write. I feel like
Hmm.
you write like it's like a scene. Even the way you just described it, like it played out like a scene in my mind. You kind of put yourself in the waiting room. Like, were you always a writer, or did you like learn to see
Gosh,
things
no.
in that observational way?
No, but I have learned as I've gotten further in my professional career, I can talk about process all day long, but it
Yeah.
doesn't connect until I tell you a story. And it's like a user story, right? Back when we were in tech, you write user stories. This
Yes.
is the same,
Yes.
it's the same
Yes.
thing. And in healthcare, we live by our patient stories. So if I tell you a patient story and that comes to life for people.
Mm, mm. So maybe speaking of stories, is there anyone that you've sort of encountered throughout your career, maybe even a patient or a colleague? I don't know how much patient exposure you get in your role. I would imagine you do, or someone that you've encountered that kind of changed how you think about what you're doing. Like maybe that story that you still can kind of go back
Mm.
to when you're like, all right, having a hard week. Like we're not we're not making a lot of progress. Like we're not getting the little wins. Is there a well of stories that you go back to that you kind of replay in your mind? And if so, like what's
Gosh.
one or two of those stories?
I don't get full patient stories, unfortunately, where I am. I hear them from their marketing team the same way the
Yeah,
rest of the
yeah,
organization
yeah.
does, but some of the things that stand by me because we see the data. So
Mm,
with our previous online scheduling vendor, we're not there yet with the current one, but we used to be able to see the throughput of this many patients scheduled online mammograms. Of the
Hmm.
patients that scheduled online mammograms, this group came in. These are the ones that had a result that required follow-up. And
Yeah.
that's the number that means something to me, because that tells me that we might have caught 45 people's cancer this first quarter,
Yeah.
right?
Yeah.
That tells me we make an impact in the work that we do. It's critical.
Mm. I just remember one of the things that we would do during my time at Hanger Clinic is we would open up all of our meetings with a patient story. And
Hmm.
it just humanized
I
the
love that.
work because we
Yeah.
were talking about, all the metrics that we needed to hit. But we were
Hmm.
like, wait a second, time out. Let's let's talk about Dave, this patient X, Y, and Z. And it made a difference. So I'm just thinking in terms of your
Yeah.
looking into the future, maybe
I
maybe a handful of go ahead.
Well, I do go out into the field, especially to work with the staff on digital registration, and a lot of times I'm trying to gauge patient engagement. So I do sit in the waiting rooms and talk to
Yeah.
patients. It's usually specific to that. But yeah, I'm seeing the mom out there with her kids. I'm seeing them bounce off the walls, and because she has a developmental screener that she can complete at home
Mm.
on the couch, uh, she doesn't have to do that on a clipboard. It's 30 questions long while her kid is ping ponging off the chair because he doesn't know what to do with himself.
Exactly.
Or uh, the solemn patient that came in who is there for a follow up for maybe a diagnosis that they're not happy about. And these are the patients that I see come in the waiting room that maybe she'll walk up to the front desk, that solemn patient, and maybe she's not going to be super friendly, but she's glad that that front desk person smiled at her and greeted her, and that's going to lighten her experience a little bit more.
Mm.
I think that that is important. I will also say one other thing about that. When we were putting together our digital registration strategy, one of the reference sites that we talked to had said, yeah, we implemented self-arrival, which is you get a text on your phone that says, let us know you're here. And then you just have a seat. And you don't have to go to the front desk. You can bypass that altogether.
Yeah.
They said they implemented that, and they got a new CEO, and they took an entirely different strategy. And from there, now they instruct the staff that they have to make eye contact with the patient within a certain amount of seconds of them walking through the door. And within a
Yeah.
certain amount of seconds, they should be greeted.
Yeah.
And that's a whole different strategy that goes against efficiency. It goes against all of the numbers, say, the financial savings. That's really prioritizing that human connection. I thought that was really um, brave in this climate, the financial climate that healthcare is
Yeah.
facing,
Yeah.
and admirable. I really think we need to find a way to work toward that.
I think I know where you're going to go with this, but I'm going to ask it anyway because
Sure.
my gut is telling me to ask you this. Is there a mistake? And if so, what is the mistake that healthcare is seemingly going to make with AI and digital
Mm,
transformation over the next few years? Meaning the thing that we're going to look back on and wish that someone said, "Hey, pump the brake here a little bit. Like, be mindful about this." What is a mistake that you feel um, could happen as a result of this? I'll just say this. I mean, this is a renaissance with everything going on with AI. Um,
yeah.
curious what your thoughts are on that.
Sure. Yeah, I definitely have some thoughts on that. I think AI is really exciting for all of the opportunities that it can bring. And for healthcare being an industry where we have historically been technologically, at least from a patient-facing technology standpoint, well behind the mark. Um, our providers get the latest technology, right? We're using that for diagnoses and
Yeah,
delivering care, but we don't think about it for the patient. And so our patient portals are kind of sad in a lot of times. And so AI gets everybody very excited that we can fix all that. But we also know, my husband's a system administrator at the hospital system I work at. I know that we have like 200 plus programs that are running across our hospital system. And some of them use the EMR as a source of truth, and some of them are feeding it. It just depends on
Hmm.
how they work.
Yeah. Yeah.
But whenever you have all of these different systems, you're going to have errors in data. So
Mm.
my first thing is make sure your data is clean, because garbage in, garbage out, right? And whether that's your website and you've got a decade of old data on your website, you need a you need to have a clean knowledge base to start from. And then
Mm.
you have to ask your AI vendors, first of all, is it AI or is it automation? Because there's a lot of automation being sold as AI that is not. And does your what are your software development processes through AI, right? We were talking about earlier that sometimes it's easy to just put out garbage. You can't
Yeah.
just have one person build something and call it prod, right? We're just going to
Yeah.
throw it into prod because it's fine. The AI said it was fine. You need layers. So we've got our data layer, and then above our data layer is our information layer. So what does that mean? What does it mean of what do we do with that data? So
Mm.
that database, we're basically giving some context to that data layer. And then the
Mm.
intent layer on top of that is a concept that Nate Jones started talking about. And I love Nate Jones. He is a writer that he comes at it from the tech side, from the product ownership side. And I've been able to get a lot of insights from him. So that intent layer helps explain to the AI, yeah, patient wants to come in for a mammogram. So let's say a patient shows up at our website. This is the best way I can explain
Hmm.
it is to give you another
Hmm.
story.
Yeah,
Patient
please.
visits the website, wants to schedule a mammogram, but we can see on the back end that she scheduled a mammogram 100 days ago. And we know that insurance only pays for one mammogram every 365 days. So should the AI say, nope, too soon, can't schedule it, and then just drop her? Because
Mm.
that's what the rule says. That's what we coded the AI to do. The intent layer says we need to find out what is in the best interest of the patient. What's
Yeah.
she
What else
trying
is
to
going
do?
on?
What's in the best interest of us, right? So it drills in a little bit deeper, understands why she's trying to schedule that in 100 days. Is it because she has breast symptoms? Is it because she just forgot that she did it and
Yeah.
she's trying to do it? So we're going to dig a little deeper. And then the layer that sits at the end is the judge layer. And the judge says, did the intent layer do what it was supposed to do? So if the
Mm.
intent layer said, nope, she's not going to get to schedule, we're going to tell her to call the call center because it's been less than 100 days. Was that the right thing to do? And if not, then we learn from it. And maybe we do some outreach to the patient. We flag that as an account to follow up on. But you have to have layers of checks at least until the AI gets better. But where we sit now, there's way too much trust being put into AI. We're not there yet, guys. It's going to take a while to get there. AI
Yeah.
is super smart about a lot of things, but when it comes to patient care, we can't be hasty. We have to
Mm.
own it. We have to be the ones owning those decisions because ultimately the patient care responsibility lies with us.
That's right. Before I forget,
Yeah,
talk about maybe where people can follow you, your work, the work of your team in Beacon. Like, give us a little commercial and a
sure.
shout out, and then we'll do just some. I'll do some quick fire questions with you just to make it fun.
Sure. Yeah, you can find me on LinkedIn, Jen Hopper. I know it's kind of a common name, but you can find me. I'm a digital transformation leader jenhopper.com. You can learn a little bit more about me. And I'm hoping to have some courses in the next couple of months for
All
those that
right.
are new to digital transformation in healthcare. So more to come on that. I'm sure you'll see it on those platforms.
Awesome. Awesome. All right. So before we round up, I was just want to throw some fun things because you mentioned a few just pieces, authors, folks that you follow. Maybe what's a book that you have given to more people than any other?
Gosh, that's probably not a good question. I don't give a lot of books. I tend
What
to
is it?
like send a
You
lot more recommendations out.
all right, Rex
Yeah.
articles. Maybe we'll use that.
Sure. I recommend, honestly, I send Nate to everybody. I send Nate
Okay.
B. Jones to everybody. He's
You haven't sent me anything, so I guess you got to send me one.
Okay, I will send you Nate B. Jones. He's wonderful. A lot of his stuff is higher tech, but I can take just about whatever he puts out there in most cases and translate it to
Yeah,
what that means to healthcare. And I do. You'll see him
that's great.
mentioned in several of my posts. So he's probably my biggest rec right now. He seems to be on the pulse. And if you're interested less in that side of the tech, Matt Wolf on YouTube does some great overviews on what happened in AI this week, and it he does that from like a lens of um, image generation, music
Mm,
generation, those other
yeah,
corners of AI,
yeah.
and he
Okay,
does it in a pretty entertaining way.
that's awesome. All right. What about best piece of advice that you've ever gotten, about leading change inside of an organization? Maybe boil it down to like one sentence.
Everybody's opinion is valid. It's not bad, it's just different, right? So
Mm,
everybody's coming at change from their own perspective. You just have to understand what their perspective is. It's not, their opinion isn't bad. It makes sense in their world. So you have to put yourself in their shoes, understand why, understanding motivation is everything in all kinds of relationships. You understand their motivations, then you can understand how to help move change along.
okay. So if you have, and the last question is just, look, you've got a community of people and action takers, doers. What is maybe one golden nugget that you can give them to say, hey, if you're going to do it, if you're going to listen to anything you've listened to today and take action on one thing, like what is that one thing?
There's so much opportunity in the healthcare space for improvement. And I think we all know that. And healthcare operates under some pretty tight budgets and some tight constraints and regulations. And so we're all just doing our best out there. And I absolutely understand that. And God bless all of our caregivers out there. It's hard work that they do.
Yeah. Yeah.
From a patient perspective, um, there's so much opportunity, and they're seeing it in grocery pickup, in Amazon orders, in their Fitbit app, right? There's so many different ways to have what you need catered to you,
Yeah.
and healthcare is doing a terrible job of that right now. We really have to step up our game. Our patients deserve it, and we've got more data than any other industry. I bet Palantir would love to get their hands on it because of all of the things that we can do with that data, that we could use. When we raised our daughter, we told her, use your powers for good. Everybody's got powers.
Yeah.
We need to use our powers for good to really champion the patient experience, to make it personal, to make healthcare personal. Because if we can do that and we can empower our patients to take better care of themselves, they will be partners for life.
I got to tell you something, Jen. I've had a lot of guests that have come on the show, and I think the thing that always gets me is that passion behind the guests,
Mm-hmm.
the conviction. Like the work that you're doing might not necessarily be perceived as glamorous work. It is
Mm-hmm.
really important work. And maybe it's not going to be in a tech crunch, or maybe it's going to, maybe it'll be in Becker's, but I just think that every single patient that is coming through the doors of Beacon is going to be getting a little bit of a better experience because of the work that you and your team are doing. And that is really cool to see and to have someone in the trenches that actually gives a shit. There's
That's
folks that are
really
in certain
kind.
seats that
Thank
I
you.
know don't. So it's nice to see that. So for those of you,
Yeah.
if you've been listening to this, and if you find this conversation to be compelling, to be enlightening, to be entertaining, please share it if you don't mind. Share it, comment on it, let us know what you found to be really useful and really helpful. And if there is a topic that you want us to explore, or maybe there's a guest that you want to have come on the show, let us know about that. We obviously are always trying to do a great job of getting great people to come onto the show. And just remember, this is a platform that is not just content. This is a community. It's a living, breathing thing. What you put in is what you can take out of it. So thank you for listening. I'm your host, Michael Stamatinos, and keep building with purpose. And we'll see you next time on the Advancing Healthcare Innovation Show.